Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae. Cellulite is a term used to describe lumpy, dimpled flesh, usually on the thighs, buttocks, and abdomen.
Now, it's sometimes described as having a cottage cheese or an orange peel texture. Although it's not a serious medical condition, it's not considered particularly attractive. And I suspect that most people who have it wish they didn't, and they probably like to get rid of it.
Maybe some people just ignore that it's there. Many cellulite treatments advertise remarkable results, but don't live up to their claims. So what can be done about cellulite? Here to discuss is Mayo Clinic dermatologist Dr. Dawn Davis. Welcome back to the program.
Thanks, Tom and Tracy. It's a pleasure to be here.
You know, I was thinking about this program, and you, of course, and I thought, cellulite, where in the world did that word ever come from? So I actually looked it up.
Wait, first we need to find out, do you know where it came from?
No, I don't.
Of course.
But now I'll know.
It doesn't make any sense. It came from the French word cellule, meaning small cell, C-E-L-L-U-L-E, meaning small cell. It doesn't make any sense to me. But anyway,
does that make sense to you?
No, in fact, a lot of cellulite is not small.
So
big cell.
What causes it?
So cellulite is a natural aging process. Essentially, we have fibrous stroma within our skin below the dead skin cell surfaces that we see that we shed. We have fibrous tissue that keeps our skin supported and keeps it attached to the muscles and fascia below. And with time, that stroma tissue breaks down and it's not replaced. And so the fat that you accumulate with obesity or gaining weight, plus a little bit of the normal fat that's there as an insulation to help us keep our heat, will herniate or project through that stromal tissue because now it's getting holes in it. And that is the appearance that you see as cellulite, which is why it looks so uneven.
My question to you, Dr. Shives, is why did you want to talk about this?
Well, because I saw a story about it, and because if you watch TV and the advertisements, it looks like it's pretty easy to get rid of. But I didn't believe it.
Is that true?
Well, it's a very common problem. Approximately 80 to 90% of adult women have cellulite, and probably almost as many men. And it's becoming more favorable in the cosmetic industry to talk about it. It used to be a subject that we just kind of hid, and now people want to get rid of it and do something about it. So it's nice that patients feel empowered to try to improve something about their health and wellness that they dislike. So that's good. So we're talking more about cellulite, and there are a few basic things that you can do to help its appearance.
And before we do that, I want to ask you about the Cellulite Severity Scale. See, I did my research for this program.
I'm so impressed, Tom.
And
I'm a little suspicious.
They can grade it grade 1, grade 2, grade 3. And if you have grade 1, you look like an orange peel. Your skin does. Grade 2 is cottage cheese. And grade 3 is it looks like a mattress.
Excellent.
Do you like it?
Well, that's a very non-scientific subjective scale. I'll be sure not to use that with my patients.
Oh, you could just say it's mild, moderate, or severe.
That sounds better.
Well, what do we do about cellulite?
So if we remember why cellulite occurs, then it's easier to address the problems. So being of a healthy weight is very important, because if you have a more generous body mass index or obesity level, then there's simply more fat cells to herniate through the fibrous tissue that then would make the cellulite be more moderate or severe instead of mild.
See, she's using my scale already.
I'm already using the scale. I'm a quick learner. So it's important to maintain a healthy weight, because adiposity or obesity definitely accelerates cellulite. The other thing is that just having more weight puts more pressure on the skin to make it want to herniate through. So being of healthy weight is important. The other thing is that if you remember that it's more of a loosening through a wicker basket or through holes, if you will, just maintaining good muscular tone around your abdomen, buttocks, and thighs. So that way the supportive tissue around your skin is firmer. That also will help give it lift, which will make the cellulite not as forced through to make it less appearance.
So exercise and losing weight.
And losing weight, which nobody wants to hear, but that's the truth. It's not an easy thing, but it's doable. And then, of course, you can always pursue liposuction if you would like, because that will physically remove not only the fat cells, but the surrounding stroma.
That is not a walk in the park, though.
It is definitely not a walk in the park, and it's not for everyone, and it's not a cure-all. We can't liposuction away every single little piece that you don't like. You can't take somebody who has a very generous BMI and simply use liposuction as a technique to take away all of their adipose.
But BMI, body mass index, meaning they're
Correct.
pretty heavy.
Correct.
One other thing, a risk factor I wanted to ask you about smoking. Are you more likely to have cellulite if you smoke?
I would say yes. I'm not sure that's ever been proven in the literature, but as you can tell, a lot of people who smoke get smoker's skin. Their skin tends to be discolored, wrinkly. We know that the components in cigarettes and smokeless tobacco degrade the fibrostroma of the skin. And so the quicker it is degraded, for example, by cigarette smoking, the more holes it would have. And the more holes it has, the easier it is for the fat to come through and be cellulite.
The only thing, though, cellulite just is, we don't like it. Is there health ramifications to having cellulite? I mean, certainly if you're not exercising and you're overweight, there's health ramifications there. But cellulite's not going to kill you, is it?
No, cellulite in and of itself is not dangerous. It's simply a cosmetic bother. It is unhealthy to be of an unhealthy weight. And we don't want people to do things that are controversial in medicine to try to get rid of their cellulite, because we do see unhealthy consequences of that.
So you talked about liposuction as a fairly definitive treatment, not perfect, but what about everything else that we see or read that's advertised?
A lot of them.
Creams, wraps, etc. Do any of them work?
So I don't think there's any cream marketed on the market by prescription or over the counter that works to get rid of cellulite. I don't think that any of those vibrating machines that mechanically break down things, so to speak, in the skin, I don't think that would be very helpful. In fact, I worry that it perhaps could make it worse by mechanically breaking down the stroma. Those bands that you can wear, they can be very constrictive. They don't really help. And we worry that would strangulate the tissue and make things worse. So if it's too good to be true, it probably is. There's no magic wand for cellulite.
Is there anything on the horizon? Or should I just continue to eat well and exercise?
Yeah, well, everyone should eat well and exercise for numerous health reasons. But with regards to what's on the horizon for cellulite, is we are looking at thermal techniques to either cool the area or perhaps heat the area to maybe cause an inflammatory reaction that's very mild below the skin, to then let the immune system take away some of that tissue. We use lasers and lights, sources that are similar to lasers, to treat other skin diseases. And so it would be a natural progression that we would look at treating cellulite in this way.
You know what? You figure that out and you will not need us anymore to become famous.
I'll come to work for you.
I would welcome you any day. You, maybe not Tom.
We've been talking about cellulite and what you can and can't do about it with dermatologist Dr. Dawn Davis. Thanks for being here, Dr. Davis.
My pleasure.